Can you comment on how your practice is set up to triage immunotherapy side effects via phone or in the office? How do you know when you need to bring a patient in versus manage the symptom remotely? If a patient develops any sort of side effect related to their immune therapy, the most common thing that happens in our practice is for them to call the office and talk to our nurse practitioner. She's very experienced in melanoma care and has been involved in the clinical trials for immune therapy from phase 1 on through clinical approval. So she knows what's going on with these drugs and with the patients. Usually she knows what the next steps should be, although of course she clears them with me during the whole process. There are only a couple things that we don't feel comfortable managing by phone remotely without bringing the patient in right away. The main thing is shortness of breath or severe fatigue, because we want to make sure the patient isn't developing either pneumonitis and or myocarditis. We want to make sure we know if they're hypoxic. We want to make sure we know if they're going into heart failure. So if there's anything that sounds remotely like heart or lung associated problems, we will bring them in right away to the office and see them. Or if it's after hours, they will come to the emergency room. If patients develop really severe diarrhea, we will also see them in the office because we want to make sure they're not dehydrated. We want to make sure that they're maintaining adequate PO intake and that they're doing okay in general. For most things like a rash or generalized fatigue, we can usually start steroids and or get the appropriate blood tests remotely without having to see the patient right away.